Ting for doing that. And welcome everybody. It does feel a little bit like we're simulating the meetings of the old days in person. We've been having only webinars since the pandemic, and this is the first time that we've just kind of met as our group again to see where we are and what we plan to do and what we have been doing. So it's great to see everybody in this more informal setting. So I just want to thank everybody for still hanging in there and still doing amazing things that you have been doing to help move us in the direction of passing the New York Health Act and Medicare for All. And thank you, Ting, for doing the tech and the chat and all of that. So what we're going to do is let's just mute ourselves for most of this, and then when it's somebody's turn to talk, unmute. And if you want to ask a question after each person's little mini presentation, I guess we'll call it, you can either raise your real hand or your virtual hand, or just in the chat write stack, and then Ting is going to keep track of the stack. Okay, so we actually have a pretty big agenda, but I think we can go through kind of quickly, although we actually have, I think, all been doing a whole lot, which is pretty awesome, I think. So I may need my glasses because I printed out the agenda in very tiny print here, but I'll try. So we had two big milestones in the month of March. Both the New York Health Act and Medicare for All were reintroduced. And for the first time historically, the New York Health Act has a majority of senators, 33, which is extremely exciting. And if anybody heard the reintroduction of the Medicare for All with Jayapal, she was, just inspiring to listen to. So on the New York Health Act, on Medicare for All, we just keep fighting and fighting and fighting. And I think that there's interest, but not expecting that to pass this year. The New York Health Act probably won't, because we still have a lot of work to do, even with a majority. So we're going to spend a lot of today talking about what we can do to really get it to a floor vote and have it actually become law. So I just wanted to mention a few things about the new New York Health Act that was not in last year's. So just, there are a few things, but the main points have to do with what the Board of Trustees would be for New York Health, and some, I think, good and very open-minded changes this year. One, the number of representatives to the Board of Trustees of organizations representing healthcare professionals other than physicians is increased from 3 to 5. The types of organizations to be consulted in developing standards for serving as care coordinators is expanded to include birth centers, long-term care providers, and labor organizations representing healthcare workers. And that, I think, is also a progressive change. And also representatives of healthcare providers serving LGBTQ patients will be included on regional advisory councils. So those three things were not in the 2020 version. And one thing that people maybe know, maybe I think most of you know, but one thing that was new in the 2020 version that's a good thing for us to talk about when we speak about the New York Health Act is the exemption for people who are on Medicare is $50,000. So as we know, the first $25,000 of what everybody else makes is not taxed at all, and then above that, at a low rate. But for people on Medicare, it's the first $50,000, and Social Security is not taxed. So I've been kind of using that a lot, because many of the people that I have been speaking to are like me in that category. So any questions about those new and not so new things? Okay. Let's see. I am going to, leave my discussion of the new New York Health Act there, and let's hear from Tim about an update of literature and also your activism with DSA on healthcare.
Yeah, Okay, hi everyone. Yeah, it seems like it's been a long time since we've had chat about what's happening in general in the Medicare for all or single payer world. As most of you probably know, I've been cranking out these weekly digests. They've gotten longer, you probably noticed, but I have a massive, a gigantic amount of material that I call through, and that's just a fraction of what's out there. But I've shifted the intent, and of course I'm always interested in comments from any of the people who get the digest. If you recall, it started out in this group as a way for us to learn about the issues and try to get a grasp on the kinds of arguments that were out there. So I always include the opposition arguments as well, so that people get a feel for them. Now, I also recognize that most people do not click on the links and read the articles. I understand. So I try to write the commentaries around them in such a way that you will learn something, even if you just read through the headlines and read what I say about it. So, and it's become fairly popular and it gets circulated. My mailing list is growing. So anyway, it feels like a good mission and I'm happy to keep doing it. Let me just point out a few highlights of what's happening in the debate world as I perceive it. One very interesting thing, and I made a mention of it in the last thing that I sent out just a couple of hours ago. A lot of the commentators from wherever they are on the political spectrum recognize that there are big problems. And I think that's interesting. Nobody is saying, isn't it a great system we have? I mean, they'll say certain things about it are great, but nobody says things are just fine the way they are. That discourse you don't hear from anybody. And that's interesting. Now, if you go further and look at what solutions they offer, they're very lame for the most part. I mean, those who are not down with the single payer concept. The things that are offered as solutions are very partial and very much tinkering around the edges. And to such an extent that, and I pointed that out in this last round, because I saw a lot of these kind of article. And what I found particularly interesting and curious, I don't know if it's the word, is that they don't even touch on the payment model. They don't talk about it. It's as if it's taboo to even mention. I find that significant because a lot of these solutions or proposals are very much technical things that people come up with, and there probably are some worthwhile ideas involved in them. But it's as if this whole issue of like, how are we going to pay for it, which is like the elephant in the room, nobody even wants to go there. So you'll read these lengthy articles, and I pointed it out in several of them that I sent today. And there's all this discussion of some technical fix to one or another problem. And, you know, the payment model is just not part of that discussion. So it's a contradiction that I think is going to become more stark. The other thing that's happening, especially after the passage of this last COVID relief bill, is there's a lot of discussion of the improvements in Obamacare and the ACA. And I think the consensus, at least from our point of view, is that there are real improvements for people which will enable them to afford their for-profit health insurance. So, you know, there's greater generosity towards people in slightly higher income brackets. But at the same time, it's creating a long-term problem, which is that it's getting more and more expensive to keep shoveling this amount of money into the intermediaries that are standing between us and our doctors and our medical care. So that's the Obamacare model. Everybody should be insured, and if you can't afford it, we'll pay for it. But of course, that subsidy in itself drives prices up. because it makes it easier for the companies to charge outrageous premiums and other kinds of copays, because a lot of people, more people are getting that subsidy. So it just accelerates the insustainability of the whole system, in my opinion. The other thing that is coming up a lot, and I keep trying to include material on it, is the consolidation and financialization of healthcare. One is hospital consolidation, which is, very destructive to people's access and to the price pressures, because consolidation and monopolization enables these giant hospital systems to raise prices on everyone. And the financialization is an ongoing issue because, as we well know, private equity is moving into healthcare in a big way, gobbling up practices and basically proletarianizing doctors in some way. It's probably an exaggeration, but it's certainly an issue that comes up and is a source of complaint among medical people who have, used to being in a fairly privileged position as sort of independent professionals or contractors, whatnot. There's also constant talk about drug prices and a lot of initiatives at the state level, since the federal government seems fairly incapable of doing anything. As an aside, I include an article by Elizabeth Rosenthal today, which she says, hey, don't throw out the baby with the bathwater. Some of the Trump initiatives on drug pricing were good, so stick with them. But, there's so much resistance and lawsuits against them and foot dragging by everybody. A lot of states are taking action on their own, and that's where a lot of interesting initiatives are occurring. And by the way, that's a bipartisan issue. Even the most business-friendly Republicans are down with some kind of way to control drug prices. Usually, anyway, so it's everybody's on board with that. There's, of course, no agreement on how to do it. And then finally, I think that the other thing that's interesting for our purposes is that the whole COVID experience and the huge deficits that were run up by the federal government has kind of killed the deficit doomsaying for the time being. It's going to come back because it's a very much an old line Republican trope, but it kind of doesn't really convince at this point, because both under Trump and currently, they're pushed through these gigantic deficit bills in order to save the economy and bring things back. And everybody knows that it hasn't created inflation, which was the big bugaboo. So that whole debate about we can't afford Medicare for all because it's going to cost too much money, and we have to pay for it before we do it, is really, it's weakening that whole argument, because clearly we can just buy the services because the US Treasury can write a check, and that's how you pay for it. And in the end, the only economic problem is that if you create bottlenecks where there aren't enough resources to provide the care, then you do have an inflationary problem, but otherwise you don't. So that's an interesting shift in the debate. And one last thing, I think it's not exactly related to us, but it reflects the debate in a slightly different way, which is the whole issue of vaccine apartheid. I think that's going to be a huge issue that we're all going to have to face, and to look at our existence as not just a pool of people in the United States that, that we would like to create into one single insurance pool in the classic sense of what insurances should be, social insurance, but that we're part of a world where, if we restrict vaccine access to only the rich countries, it's going to boomerang, because we will be living with COVID for a lot longer if we continue on that path. So even though it's not directly a single payer issue, I think it's related to our cause. So that's my summary. And as always, I'm very interested in people's reaction to anything that I send out. So please answer if you ever have a thought in that regard. The end.
Okay, thank you, Tim. And I did read your notes today. It was a busy day. I saw it come in and I thought, I don't have to read every word of these articles because you really explain it so well, which is really appreciated. And much more entertaining and better writing than some of these kind of rambly articles that show up from time to time. Okay, so thank you always for sending those articles out. Is there anybody who doesn't get those who would like to get them? If so, just put your email address in the chat. I think most people here probably have been subscribing for a while. Okay, so next on our agenda is to celebrate Rachel. And I wish we could do it with a cake and food and music and everything else. So, so Rachel just got her PhD, and huge congratulations for that. And she is going to tell us about an amazing new job that she has, and then she'll tell us what Students for National Health Program has been up to and will be up to.
First, tell us the title of your dissertation.
Sure. So thanks, everyone. The title of my dissertation was Human T-Cell Negative Selection in Health and Disease. And it feels amazing to be done. So I defended on March 18th. Yeah, March 18th. And it was all virtual, but no tech issues happened, which was very nice. So it's been about 5 years of work. So I still can't, it's still sinking in that I successfully defended it. So thank you everyone for the congratulations. And I actually started a few months before I defended, I started a new position. So I got a job as a congressional affairs specialist at the FDA. And I'm very excited about this because it kind of combines my love of health and science policy and straight science work. And so basically in this job, we kind of are the people in between Congress and the FDA. So if Congress has a new bill that they want to pass and it has something to do with the FDA then provides them with things like technical assistance on how the bill could be made better and things like that, and vice versa. So if there are questions about what the FDA is doing or things like that, which obviously related to COVID a lot right now, but even, I mean, food, cosmetics, you name it, Congress will then either ask us for a briefing on it or potentially it could go to a hearing, things like that. So really enjoyed the job so far. I'm definitely still in the learning stage, but I did get to run my first congressional briefing a couple weeks ago, which was exciting. So it's been exciting. It's a little bittersweet because once we go back in person, it will be in DC. So unfortunately, I'll be leaving New York, but I intend to stay connected with everything happening in New York, with all of you and all the groups I've been a part of, and especially the New York Health Act. I can't leave that behind. And so I can, oh, Julie, I think you're muted.
I am muted. I was just going to thank you and keep celebrating you, and then ask you to, if you can enlighten us about what's going on in the student organizing world.
Sure. So the big thing that's going on right now with SNAP, which is Students for a National Health Program, is we are planning our annual summit. And so this year it is obviously going to be virtual. And as much as we like to have the in-person summit so that we can have social events and networking events, we are finding a silver lining in the fact that it's virtual because we're actually expanding our advertising and our publicity of the event to other student groups that normally aren't involved. So we're expanding to different health professional groups that maybe, you know, wouldn't actually make the trip to wherever we have the summit, but since it's virtual, we're kind of lowering the level of engagement engagement that people need to, or not the level of engagement, the threshold to participate in. So it's free for every student. And we have folks, again, from different health professions, but also different groups. So we have from the American Medical Association, actually, their student sector, which is more supportive of single payer than the general AMA, which is very interesting. So we have some members from there. We have some students from White Coats for Black Lives who are coming, as well as LMSA, Latin American Student Association, and things like that. So we're very excited to have a wider reach, and we're hoping that, you know, we can kind of make it a silver lining and also recruit more members for SNAP, but also just more coalition partners, which is kind of the theme of what we've been trying to do this year. And then one other thing I'll note is a group of some of SNAP leadership met with Stephanie Kang, who is Representative Pramila Jayapal's health policy advisor, ahead of the bill introduction to talk about things that SNAP specifically saw that should be included in the bill. And we also are having her as a speaker on one of our student activist calls next week. So we're very excited to have that connection to talk about things that we believe should be in the bill. And so that's pretty much it.
Well, thank you, Rachel. Just really nice to have you and be inspired by you over and over. And I've noticed a lot of wonderful SNAP stuff on social media lately also. Really big presence, including a myth and fact. It seems like a daily thing on Instagram that I've been seeing. You know, a myth about Medicare for all, and then a fact followed by a fact. It's just, you know, straight out, clear, and really well done. So, you know, I think SNAP is also getting some publicity these days, which it seems that there are more and more medical students. Certainly, compared to when I went to medical school, there was, you know, there were very few people who were even thinking in that direction, and we're just seeing, you know, much more of it. And you and the rest of SNAP leadership should take credit for that.
Well, thank you. And I'm glad the social media is getting out there more, because that was one of our goals this year too, was to build up our social media presence. And I think we have a separate media team, and they've just done an amazing job with that.
Yeah, it's been great. Anybody, any questions or comments for Rachel? Okay. So next on the agenda, organizational endorsements. And I just want to give a great big thanks to Harold and hear from him about a really important and impressive endorsement that he was able to obtain for the New York Health Act. So, Harold.
Oh, it'll be a short report. There were two organizations that I was trying to get the endorsement for. One was SAGE, which is the Services and Advocacy for the GLBTQA?I groups. And I don't know exactly what's happening beyond the endorsement, and that they will be in contact with all the other organizations that they're networking with, which would mean basically all of the groups, the deaf, the disabled, of every genre, really. I don't know, I'm not up to date on all the interconnections, but there will be this statement going out because they're working with their lobbyist in Washington. So they're aware of what the endorsement is. And I don't know, but there is an active network of all the affiliates throughout the country. And the person that I was in contact with in Chicago is no longer in her job. So, but I can safely say that it is now part of the SAGE program. They haven't put out a newsletter recently. Used to be coming out once every month or 2 months. Probably when the pandemic is over, in the sense that they'll be able to get back to work, I could update you more. The other point was that it was the Union Theological Seminary that the vice president said, yes, they are endorsing it, but he's also been involved. He's now the head of the civilian complaint board. And so he's been kind of inundated with that. So I'm not sure where it is, but hopefully by the time next meeting, I can give you some information on that.
That would be great also. I mean, those are two, amazing connections, really. I think that, for a whole variety of reasons, they're important. And there's if there's any way that we, the Campaign for New York Health can be involved with either, I know that there was a really great endorsement letter from Sage that went out as the memo of support to all the legislators, which was just, beautifully written and detailed and very, very serious. And I think it would be hard for legislators not to notice the importance of that. And there's also, another initiative about faith leaders taking moral positions and supporting single payer for that reason. There have been, some different religious institutions that have signed on, quite a few over the years, but I think that that's a very well-known place. And so if we can enhance that, that's, just really, really appreciate your getting those endorsements and some time went by and the pandemic went by and, you persevered with that. And I just want to say thank you on behalf of the whole Campaign for New York Health. And the fact that Sage has a national presence, I think that the Medicare for All piece would also be easy to translate that into national advocacy as well.
Right.
Anybody, any questions about that or anything else about organizational endorsements? So there's a big push to get more organizational endorsements. We have hundreds, but we need more than hundreds. And then not only do we need them, but we need the people who are members or people who pay attention to those organizations to understand what it would mean for them to have guaranteed publicly funded healthcare. So these are vehicles for activism, building on activism. So it's really, really important. So I think everybody here has been thinking about what organizations you might be part of that could endorse, and just keep thinking, because it makes a big difference when the legislators know who's endorsing and why. Okay, so thank you. Reading my own tiny print here, legislative strategies and legislative support. Ting, do you want to start and then I'll say some more?
Sure, okay. I don't know if everybody knows, but there's going to be a week of action beginning on the 12th. That was partly spearheaded by DSA. They put a lot of research into doing things. And every day there's going to be a different event that happens. On Thursday, Tim, you were going to drop that link, I think, in the chat. On Thursday this week, day after tomorrow, there's going to be a get together to kind of talk over what we're going to do, how it's going to work, and so forth. And that should be interesting just in its own right. At the moment, I don't have, if anybody does, I would love to get it. I don't have links to sign up for any of the actual days of stuff happening. And we're standing by it, and I plan to put that out as soon as we hear it. So if anybody gets it, but maybe it's every day is a different link. I don't know how it's going to work, but if anybody gets it, let me know. Tim, you want to add something to that?
Yeah, just to clarify, and I'm pretty sure that the Thursday meeting is to discuss the financing of the New York Health Act.
You're right.
It's specifically on that topic because there was a 3-session study group that looked at the RAND report and discussed it. So we're putting it together as like a teaching tool for people so that they go into the next phase the following week with, armed with the latest information to discuss the financing issue.
Yeah.
Thank you. So the other thing I was going to mention, there's going to be, but we don't have the dates on that. There are going to be weeks of action also on different subjects. Now that the budget is done, then other kinds of legislation will be talked about. And so many different groups that we co-organize with are going to be sort of piggybacking with us and we with them. We don't know exactly what that's going to look like or what weeks, but it's really, it's a little different from just saying, you know, we'll back your bill if you back our bill. This is really compelling from the point of view of these issues are really interrelated, and people recognize that more and more, that if you talk about, you know, racism, one of the big issues is racism in medicine and how single payer would help. And we've had, you know, a lot of literature and a lot of talks about that. If you talk about housing or homelessness and how it relates to healthcare, you know, there are just so many issues, you know, the parole justice bills. So we're really organizing with other groups, you know, in a very sort of hands-on way, because these issues all have to do with each other. So our coalition becomes everybody else's coalition, because all of these humanitarian issues are really together. So I don't know the specifics of how we're doing that, but we're having some of the weeks that the different organizations are lobbying, for example, the parole justice groups. And, you know, so we will be talking about how health justice and parole justice are related. And that's one that I know of, and immigration is another. And there are more. And then there are going to be some business alliances, and, you know, education and healthcare and how they're related. So, you know, it feels to me as if it's on a deeper level than just what we used to say is, you know, there would be more advocates if we support each other's legislation. So, you know, different groups have a medal of support for different bills that somebody else is working on. But I think particularly since COVID, there's much more of an awareness on the part of the activist world in general of how interrelated all of this is, and how it's all one big humanitarian common good view of what we can do on the state level and also the national level. And that's another thing, back to Rachel, I think that the students have been really looking at that intersectional organizing in a really impressive way. Anybody else want to comment on that? Okay. So healthcare workers is another subject, and we had a lobby day just for healthcare workers, and several people on this call were present there. Kai and I were in the same meeting with a staffer of Anna Kaplan, who's one of the Long Island senators who's not signing on. And Tim, oh, you were on the same one. That's right, the three of us. So, you know, I mean, there have been some successes, obviously, to be able to have 33 senators at last, have the majority. And then there are senators who are the priorities who are more likely to turn around and support. So there will be more lobby days, and there are a lot of ongoing lobby meetings that are going to be happening, you know, this month and next, to try to get new senators on. But the other thing that we're doing is really, and this I think applies to our district as well, is to get our senator who, you know, has been supportive, and we had those 2 town halls. I want to say last year, but last year was the kind of the missing year. I guess it was fall of 2019 that we had 2 town halls with Senator Jackson's office. But he doesn't really talk about it so regularly. So, you know, we need our healthcare heroes to be very vocal heroes to their constituents and also to their colleagues. So, you know, that was a question, very specific question I had. Is there anybody who is willing to take on that role with Senator Jackson, to ask him to mention it in all the newsletters, to ask him to, you know, speak about it whenever he has an opportunity? Anybody feel like taking that on? Well, we'll find somebody, because we have worked a lot with him, but he could be doing more.
You know,
Tim,
Julie, I think I could try that. I know all the staff there pretty well, so I might be able to just open up the topic and see if they have anything to say about it.
Great, thank you. Another possibility is to get to know a little bit more about some of the legislators, and Jackson in particular is very passionate about education, and education and healthcare are very connected to each other also. So it's not that big a shift, to just add something about the New York Health Act when speaking about the issues or the committees that other senators are on. Can add the New York Health Act, and if they're co-sponsors, they can be encouraged to get behind it. So that's in our neighborhood what we do, and then we also have phone banking to some of the senators, particularly the Long Island group that seems to be working as a group to not sign on to the New York Health Act. So I don't, Ting, are you involved in the text banking or not at the moment?
Sorry, I'm not, no.
Okay, well, there will be more text banking, and there's always more phone banking. So that's part of what we're doing, on the legislative front, because it has to get to the floor. Anybody else, any comments about the lobbying with those senators? Like Tim and Kai, any feedback about that day, the healthcare worker lobby day with the legislators?
I just would say that to encourage people who have never done it to get involved, because, these meetings with members of the legislature or their staffs, they have to listen to you, whether they like what they're hearing or not. And I think that especially people who are not particularly, who haven't done it before but have personal stories, those are very effective, especially if you're a constituent. So think about it, if the opportunity arises, to try to do it.
Sandy, you were there that day also. Were you in a lobby meeting? You're muted. You're muted.
You have to unmute, Sandy, we don't hear you.
All right, we'll come back. Sorry. Kai, did you want to give any feedback about that day?
I don't have too much feedback. I guess I would second what Tim said. These meetings are things that I feel like are effective to some extent, and even if it's not to a great extent, it's like we can't not do them. We have to make our voice heard through the stories and through our analysis. Through the meeting with Kaplan's staff, I know Kaplan's part of the Long Island Six, and sometimes in these meetings, I honestly feel like, how much are we really getting through, or is the senator or legislator going to listen to the points, or do they already kind of have their minds made up, or are they in the pockets of someone else, rather than us or the people, their constituents? But we can't not do it. We have things that we want to say, and I guess I would just second Tim to encourage everyone, based on your capacity, to go out there and make our viewpoints heard.
Yeah, I think it's when it's constituents, and also when it's healthcare workers, especially now with COVID. I think that we can't be as ignored as we used to be. But it was significant that the three of us were in that same meeting, and it was, I think, not a very high level staff member, although she certainly looked as if she was moved by what we were saying. I thought, not that that's going to move the senator she works for, but that's one of the reasons, again, I have a lot of faith in the younger generation, because the staffers of today could be the legislators of tomorrow, which is another, reason to be patient and just keep pushing and pushing and pushing. It seems as if, and some people think there's, specifically an alliance among those Long Island senators not to do it. And that's why we have to keep building the momentum, because the more constituents that ask for it, And the more, I think particular groups like businesses, and the number of businesses supporting it has now grown. These businesses are also hurting from trying to pay for health insurance that's increasingly impossible to pay for. So, yeah, were you going to say something else?
Yeah, I guess the clarification point, Julie. I don't even know. Do we need those 6 to sign on, or does a simple majority, the 33, work for us, or do we need 2/3 or something like this in order to pass?
No, the majority could work for us, and if the governor then signs it, but it needs to get out of the committees, and so the more senators, the harder it is for the governor to just say no. He once said, assuming he's still our governor, maybe we get a special chance to kick him out, which we hope we can. But at one point he said, "Yeah, I'll sign it if everybody is stupid enough to vote for it." So the more everybody's in the legislature, the better. So we keep doing that, and also to get it out of committee. It's just too close. They're just not going to get it to the floor without more obvious support. So at least it's very unlikely this year, but it still could happen. And I think we should do everything we possibly can to make it happen. But no, to answer your question, we don't need those specific legislators. We just need to get it moving.
Just one last comment. I was inspired by this meeting to sign up for a primary challenge against that member of the Senate. If it were to occur, I said, I don't care how far I have to travel, I will happily go and campaign against this element.
Yeah. That's the other way we do this. Who else was at that lobby day? Rachel, were you in a lobby meeting? No.
No, I think it was like the day after I defended or something, but I just kind of gave a rundown of the year prior when they first started the planning. So I'm glad that it all well.
Thank you. Okay, let's see. There were going to be a couple of people who were representing the business community who were coming to this meeting, 2 recent people that we met actually through our Facebook page, but they're not here. So we're just going to keep organizing businesses as much as we possibly can. And if you can think of any businesses that you frequent, they may have a higher level of being receptive at this point. Again, I think that the world has changed in terms of COVID, so we have more points to make. So next, let's have Jennifer talk to us about the bilingual team, what it has been, what it can be, and what it will be.
Hi everyone, it's nice to see you all from Julie's living room virtually. So just to resume, I know in 2019 we did a lot of field work for the bilingual this community, and we went out to like plazas and community events to spread the news, education. I know that Tim, Charlie, me, and Carolyn, we also had some an education part where I think this happened in 2019 as well, late 2019, where we met in Mary Louise's house and just learned about different terminology in Spanish to talk about, our topic. And that was really helpful. So we had that education part. And then in early 2020, we did some live TV community like outreach where we spoke about it as well. And then we met with Carmen de la Rosa Assembly. She offered her office to us, and we had meetings. And then I think the last meeting was where we had a lot of Spanish TV outlets that came and kind of like heard us out about just exactly what everything happens in English, but in the Spanish world, and definitely internationally, the Dominican Republic. So I know that our bilingual team was starting to grow. I don't know now where we stand, but I do definitely I have motivation, and I'm very encouraged for it to continue virtually. I have ideas just like the campaign for New York Health Act, how they've been doing like social media, like toolkits. Every time they have something, I take the Spanish stuff and I just put it out there. But I also don't see like virtually that, the Spanish community does know what really is going on. I think because of COVID, they're just not getting too much information. Like I said before, there's like two main outlets that Spanish community see, which is like Telemundo, Univision. You don't really hear about this, and if they do, it's only 2 minutes, even if they even get to grasp it. But I know that we were talking about it in depth in 2019, 2020, when we're talking to like the public or on live TV. And I think something we could do that I would throw out there as brainstorming is maybe do like a little streaming in Spanish, uptime folks who are bilingual, just like we used to do, like instead of going to places, right? We're just talking about it, see what the comments are. I dealt with streaming before in Spanish outlets and, see what people know about it. Streaming is more like they're commenting at the same moment that you're talking. And I'm thinking about like storytelling in Spanish so people can grasp like what is this? And just like our education part at Mary Louise, it's a different aspect of talking about it as well than in English. So, from Washington Heights, the Dominican community, I would definitely want to motivate to learn more about this topic and to be more engaged, even if it's virtually, even if it's out there, some imprint that, someone is talking about it in Spanish. I've only seen, only for the campaign of New York Health Act, that they talk about it in Spanish. Caroline's been doing a great job talking about it in Spanish, but maybe the community just more involved, even if it's a streaming, if it's Zoom through YouTube, you have a channel, UPA Single Payers Bilingual Team section, and it would just be like talking in Spanish and educating people. Just because it is important. It's a big need. Trust me, it's a big need. I talk to my aunts and people in the Heights, and they don't understand completely, but they get it. But I think we should talk about it more. Sometimes, orally talking about it, it'll travel until make some noise. And right now, social media, anything could happen and it'll become a boom. So that's just some ideas that I have.
Ting?
Sounds great, Jennifer. I just want to say that if you want to move ahead with that, the UPA can help you in terms of producing flyers and getting them out in the street to people. Like, let's say you're gonna start streaming on whatever date, and here's a subject and whatever. I don't know what you help design the flyers, but we can produce them for you and help get them out in the streets.
Yeah, definitely. So I mean, when Julie, Mary-Louise, and me hit like the plaza in 175th, that was really good because there was a whole bunch of people, and a lot of people are going there now with the COVID times, just continuing to go. So I'm one of the coordinators of those festivals. So we already got the permit for May, so we could talk again on the mic and we could hand out flyers because people want somewhere to go. I know it's very social distance and everything. There's gonna be a lot of people dancing, but again, we could start there again and just start making it aware.
I'm interested in the streaming, and then I guess, Michael, you had your hand up, but just if I can ask that question about, so where would you stream and what do you need to do that?
I've done like streaming with StreamYard. It's like kind of this platform that you utilize, and then it goes on YouTube and Facebook at the same time. So people, while you're explaining or talking or storytelling, people who are on YouTube connected can actually comment and saying, what, can you repeat that again? And in Spanish, and you could just repeat it. And it's an open dialogue and it's interactive. So it's something that you guys can do also for UPA, but for the Spanish speakers, it'll be good because there could be a lot of storytelling and it will be saved that you could actually go back, and then the people who are commenting are just like any person, and it could be any person from any other state as well, you know. So if you're interested, I'll be delighted to let you know more about that.
That sounds really good to me, actually.
Does.
Anybody else want to be part of that? I know Wendy said that, and Wendy is fully bilingual. She said that she would be happy to. She couldn't make it tonight. She'd be happy to do anything. And she's been texting about Medicare for All through National Nurses United. So I'm sure that she said, let me know what I can do. So if there's some way to do that together, that would be amazing.
Yeah, I mean, we can.
Anybody
could talk
do
about
that with anybody, any other bilingual people? Charlie is out of town flying back tomorrow. So, I'm sure he'll be interested also.
Michael had his hand up.
Yeah, I just wanted to say I've been working with Grassroots Action with the representatives, the legislators from my district. It turns out that there are quite a few people in Grassroots Action in my district, and we prepared some material that we sent to Assembly Member O'Donnell, inviting him in English and in Spanish, and I'm going to put it in the chat. That inviting him to include it in his next newsletter. Well, we never got an answer, but the material is still seems pretty good. And we all, by the way, since you did talk about legislators, this group Grassroots Action had a meeting with a staffer from Senator Brian Benjamin, which was very positive. It's not made it clear it's not his priority, his legislative priority, but in any case, it was a good model for a future meeting. Anyway, I just wanted to provide this material that you can use or not, or modify anyway. There's the, let's see. There's this, that's the Spanish translation, and I'll try to find the English version, but
Thank you. Brian Benjamin has signed on to the bill, but he doesn't really do anything. He's one of the on that list. So who else has a different legislative? Okay, you had your hand up anyway.
Just a quick question to Jennifer, because I was thinking the streaming thing is great and could be repeated, but is there any vehicle like a podcast or anything that works for the community that you're trying to reach that could be an ongoing thing? And I'm thinking about this because NIPAN is now doing a daily news thing, which is not directly related to this, but it mentions the Health Act, but as a way of trying to be out there all the time. And so, and that's just a web thing, but is there something that would work on a repeated basis that we could do over and over and over again?
Yeah, well, with the streaming, that you do it like if you want to do it monthly, or you could just have a schedule, which you'll say it'll go through your Facebook, the UPA Facebook, and it'll say like what's it about, right? With that platform that you'll be utilizing, and we can have a schedule. Like today, we're going to talk about educating people on certain terminology, what this means. It's going to be saved, definitely on your YouTube account under that name, but people can reference back. But the thing I like about it is that it's an open dialogue, and people can comment, and also you can evaluate just the questions from the Spanish community, like what is it that they don't know that they keep questioning, or or they make a statement now. I'm very worried that they're not, nobody that I know, my community, I work in the Bronx as well, they don't know about it. Very few people, they're like, oh yeah, I spoke about it, but I really don't understand it, and I like more storytelling in Spanish. I think they'll get it more like that. So there could be an education part of it, which we already experimented before in 2019, late 2019, or I think early 2020. Um, the outreach, we could also go to different outlets who have virtual streams as well and just talk about it. Before, like Tim, me and Caroline, we went to the Dominican Commission of Culture in 145th Street, and Cesar, he's a recognized figure in the Dominican community. He has a TV channel, I think on Manhattan Network, Neighborhood Network, and a lot of people see that. So we could do that and just do it virtually as well. But with what you said, it could be something programmed, like every month at this time, we can invite people, you know, um, and we could just talk about it. I think it's important. It's good that the Spanish community is being involved, and that there's an importance element towards that. It's also important for this community to know, not for like talk COVID all the time, and then 5 years pass by, and then like, oh, they didn't know, you know. But and then I work in research, so I would love to do some type of evaluation, especially with the Spanish community, to see what did they learn, or what did they grasp, to see what can we do later on. Because everything's about promoting. We could give a flyer and all this, but what's going on, how they like perceiving things, to continue.
Have you been in touch with Ursula about that? Ursula, for anybody who doesn't know her, she's one of the
Yes.
co-directors of the campaign.
I've taken like I think 2 trainings with storytelling. They're great, but here, if we stream, we could have people from Jersey, from Connecticut, doesn't matter, from California, who could just like, learn about it. I know, so me and my partner, we had this like streaming New York Dominican. It was more about culture. And we spoke about a little bit about the New York Health Act when they had this survey about people who were affected with COVID. And I remember we spoke about it, Julie, and I had seen it too. And what I did was, because I knew how it was going to be, if I tell them they're not going to go, I put the survey up, just like we're here in the Zoom meeting. I put it up. We went through, different questions, and we had somebody talking about how they got COVID. And, we invited them to take the survey. At the same time, people saw like, what were the questions? And this was early on, talking about April, I believe, from last year. So things like this to interact and engage. And it takes a lot of energy, and it takes a lot of engaging. But, from me, that's fine, because I work in research, and the majority I work with Spanish people, and I have 10 years already of experience of just engaging, and I'm good for that, so that's just an idea.
Yeah, no, I think that's great. I mean, we could do it on our Facebook page maybe, and also I wonder if the campaign for New York Health would want to do it on their Facebook page.
Yeah.
I'm a bit of a Facebook Live dummy, but I'm curious, Ting, do you think that that's doable? Or Rachel, anybody who's
I'm thinking more about
engaged
how heavy a lift it is to try and do something on a regular basis, like I don't know, every other Sunday afternoon, or whatever you think is good for the community, and have so that we can do outreach. I think outreach ahead of time is the key, and continued outreach, by flyers or however we can do it in the neighborhood, post things up and so forth, to get people to come. As long as they know that it's something that's good, but that's the hard part, is doing it regularly over and over.
Yeah, what I think one of the things I do when I stream is I research like what groups out there on Facebook exist that talk about this topic, that I could just, at the same time we're streaming, we're sharing. So I have a trick that in the beginning, when it starts, I'm already sharing there. So who's ever on that group is going to see, oh, there's something going on. Or like you said, outreach before, so they could see a flyer, virtually. And that I could again go, these are the public groups out there, and people engage. So
Yeah, I'll just add, I think it's a really great idea. And I think there's been a lot of examples of like even politicians starting to use like Instagram Live and stuff. And it just is a very low barrier for engagement. So you can just sign on and pretty much, Jennifer, what you were saying, I think explains it all. I think it's a really great idea to hopefully reach a wider population. And there's been good examples of people getting a lot of amplification just through streaming.
Yeah.
So amazing idea. I think you're doing a great job, and I hope to see you do it soon.
Yeah, definitely. I thank you. I mean, I'm more interested in what these comments are gonna be like. Like, what are like when we start talking, just to see like what's going on. And my goodness, if we get some of the research out of it, that'll be great for us to represent that out, how we're outreaching virtually and all these things. But I'm also in May, the plaza is gonna be open, so I could get those flyers and I'll be giving them out, and I could talk also. Whoever's feels comfortable coming to the plaza, because I know there's gonna be a lot of people.
What date is that?
We're starting the first week of May. We're celebrating Cinco de Mayo that weekend. I'm already starting to get performers. So
So can you send Julie or me or the information as to when?
it's every Sunday until October.
Okay.
Yeah. So I have a meeting this weekend with the organization who sponsors it. So after he needs to do a flyer for 2021. I'll send it to you guys. And like, Julie was there last time. She saw how it was. It was a lot of people. And I continually see a lot of people gathering there without an event, but it's a hot spot, for like where the Dominican Spanish community are heavily there. And we could continue educating. And Rafael, Julie, you met, who's the person,
Yes.
he was really, he was really open about it. He's more for the people than politicians. He's like, no politicians help me. I'm just here doing this, and it's for the culture. And I'm a cultural person. I have a cultural group in the neighborhood too. So, for the people.
That's wonderful. I mean, I think that's great. The idea of combining the in-person and then the streaming. Do you think that only vaccinated people should go? I mean, you feel as if it's a safe place to go?
That's one of the questions I've asked Rafael about, because he got the permit, but I'm also asking like how many people can be within there, and I still haven't got an answer yet, because this is something the city has to provide him with. But of course, we're gonna have the mic, so we're gonna be, just like talking on the mic and flyers, So I'm okay with doing it if nobody feels comfortable. But definitely, Ting, if you want to meet, or if anybody wants to meet another day and talk about the streaming, we could do that and we could try it out. It's just an open dialogue. It's open and trying to see, what's going on. And like, I feel like it's something we gotta do, because everything's virtual now. Like, just let's do it.
Thank you. That's awesome. What about at Montefiore, or anybody who's connected with a hospital? Kai, what about, you're in one of the, which hospital are you at now?
I'm at Lincoln right now.
You're at Lincoln, okay.
Yeah.
So I wonder about, how is that in terms of, hospital staff being interested in the New York Health Act? Both of you, Montefiore and Lincoln.
Yeah, I haven't heard any talk yet, but the residents that I work with are really progressive, and I think they're always trying to get involved in stuff. They have like a social medicine or social emergency medicine resident group that I feel like potentially I could reach out to their leaders, their coordinators, and see if it's something that we can loop them into.
That would be great. Would you want to do like a New York Health Act 101 kind of presentation?
A New York Health Act what?
101, like the introduction to the New York Health Act. And
yeah. I think I could probably do a primer or something at maybe a Wednesday conference or something like that to at least get folks get folks involved, like a 5 to 10 minute thing.
That would be great, actually. And, if you want any support from PNHP on that also, and the Campaign for New York Health, that would be terrific.
All right, then let me reach out to the residents and see what I can do.
Wonderful, thank you. And Jennifer, how's Montefiore in that area? I know the social medicine program was, that very much involved in the Healthcare Workers Lobby Day, but
Yeah, no, I saw like the news on the emails that we get from the hospital. They've been doing like lots of work, especially the nurses as well. I've been like seeing like from the emails that the president from Monty sends. But I was in one section of the clinic before COVID. Now I'm in a different location. So the people I used to talk to about it, they will always like listen and they will get the flyers. And these were people also who were willing to come out to the events. But I will have to reach out to them again. I'm a different clinic, so I'm not really so socialized. Actually, there's not a lot of people. I go because I have to see patients, but a lot of the counselors are working remotely. So, but I do, I could still talk to people about it. It's just like my old clinic. That's where, and someone that actually was really motivated to learn more actually passed away. She was a nurse, and she got affected by COVID. So she was one that, every time I would go out and outreach, she would be there with me. So she was like my buddy. So that was one of the people. Yeah. But definitely, I'll talk to some people in the other location where I'm at.
thank you. John, I just saw what you wrote in the chat. Do you want to elaborate a little bit about what you're doing and what you might do with those connections?
Well, I can, sure. And in fact, I was just texting Judy just to make sure that I was okay to mention her. I'm with Trade Unions for Energy Democracy, which is a global network of unions based at CUNY's School for Labor and Urban Studies, working on public ownership of energy. And NISNA is actually one of the unions that's part of our network. So that's how I know Judy, but I'm also a big supporter of Medicare for all, or whatever version of that we can win. And I know NISNA is basically one of the main unions, if not the main union behind this. So Judy's a good friend. Happy to talk to her and see what we can do. She's just sending me messages right now about the bargaining process that they're in. So.
Okay, well,
I don't know what the specific ask might be, but I assume people know her. She's a tireless activist and completely 100% behind this. So
yeah, we do know her, and also how busy she is, and she speaks on some of our big calls. She spoke on a major call that we had. She's fantastic.
Yeah.
So, but locally, where is she at Montefiore, or where is she as in her?
That's my understanding. Yeah, I think she's an ER nurse, and I think she only works a couple of shifts a week, or maybe even once a week. She's mostly busy being president of NISNA, but
right.
She is still a working nurse, I know.
So, maybe there are some, smaller connections that she can help make, which would be great.
Yeah, I'm happy to talk to her if I can just get some sense coming out of this call of what I should be asking her for in terms of contacts, speakers, anything like that. Happy to do that. She's just texting me all the forces against the New York Health Act donate heavily to the entire legislature, i.e. the hospitals. So no surprise. As you all know. As we all know.
That's why it's the big fight that it is that there's big money closing it because they have more to lose. So we have to have big voices. But one of the things we can do anywhere where we have any connections, is to have virtual events with speakers. And that's what we used to have in-person events, in a variety of places. Mary Louise isn't here tonight, but just by absolute random chance, through PNHP, Physicians for National Health Program, I am a board member of it. So is Rachel, and we actually, Rachel, you started this initiative of what the outreach committee was going to do, of just taking a few names and reaching out to people. And so one of the people that I reached out to is a staff member of the Haitian American Community Coalition in Brooklyn. And I just called him and said, you're on our list. I know you came to a forum that we had on, it was the death of a Black physician who knew that she was being mistreated in a hospital in Indiana, and there was a lot of attendance. So this person in Brooklyn attended the forum. So we were reaching out to people. Rachel started it, somebody else took over the initiative, and this person I randomly got is now asking for his whole staff to have a Zoom about the New York Health Act. And that's kind of the way it happens. And that's how we spread the word. And I think it's starting to happen a little bit more now virtually. I think people were just so hit with the shock of COVID that some of that was on hold, and some of the in-person meetings that some of you in this meeting had scheduled, including Jennifer, you and I had one scheduled with NIMIC, Northern Manhattan Improvement Corporation, to speak to their staff, because one of the things that we find is just people even working in healthcare and doing healthcare advocacy don't even know what the New York Health Act is. And then when people find out about it, it takes them a while to, it's like, this is too good to be true, so maybe I don't believe in it. And then when they hear about it, it's, oh, I guess it is true. So, there's some, I think, important meetings to be had now that people are somewhat less shocked about COVID, although that's not quite, I wish it were, but that's not quite the real story. But I think that those meetings are starting to happen. So, anybody who is part of any group where we might grow advocates for the New York Health Act or Medicare for All, we're all happy to be speakers or ask for, speakers from NISNA. Can anybody offhand think about any group that okay, you were writing something. I didn't, you want to say it out loud? Because I didn't get to read it.
Talking to me?
Yeah, you
I just posted a link. Yeah, we this isn't NISNA, but we actually did a report for NNU about 18 months ago on nurses unions, climate change, and health. It's not directly related to this conversation, but I thought it might be of interest to people.
Well, in some ways,
didn't mean to interrupt.
No, I know, but it's also related in the in the way that we were talking about before, about that healthcare is not isolated, and certainly climate justice and health are intimate partners. So, so yes, we need speakers, and yes, we need people to speak to. We need organizations to speak to, and sometimes we just trip over them, the way I did with this random phone call. So. Basically, the message is, let's keep it up and keep up the organizational endorsements and keep up the pressure.
I'll just say thanks for sharing that, Julie. That makes me so excited to hear that the Welcome Committee is rolling and bringing in results like that. That's very exciting. Yeah,
there was actually I was lucky. I mean, out of, I think, 5 people that I contacted, 2 of them decided to get really seriously engaged. But this person in particular, this person just got his MPH, and I can see him as somebody who might really get involved in the movement. Very interested in doing one of those videos, like Kai has this wonderful video of just, it's just like so matter of fact, like we're sitting in your living room and you're saying, why as a physician you support the New York Health Act. And it's just, so well done and so obvious. And we're trying to just, get as many of those also and have them all over social media. So anybody here can do one of those selfie videos and send it to us, and just, it gets amplified and amplified and amplified and used, actually, some of them year after year, including Kai's, that I still get some mileage out of yours. And Rachel too, you're all over the place. So some of our old photos. So everything that we've done in past years that we did in person is documented someplace, even if it's a still photo, the hearings and everything done. Anybody else want to comment, question, and then we just have a few announcements and that's it. So, anyone? Colette.
Hi. It's Janet.
Oh, I thought Colette was raising her hand. I didn't.
Yeah, I
Janet,
did. But go ahead, Janet. Go ahead.
My hand. Okay. Oh, should I just go ahead?
Yes.
Sure.
Yeah, I just heard something strange on Democracy Now! Today. I didn't catch all of it, so I don't know where this is going on, but there are some hospitals, I think in New York State, that are suing. Can you hear me now? I just popped off.
You're back.
Just hospitals that are suing, but you're back.
Yeah, there's hospitals that are suing patients over to collect unpaid bills.
I think it was Langone.
Yeah, and you can go to WBAI.org and bring up the archives and listen to all of Democracy Now! From today. Like I said, I tuned in a little late, so I don't have all of it. But oh yeah, right, NYU Lang.
NYU Langone and Northwell.
Sorry, my Zoom keeps popping off. So anyway, let's hear from Colette.
Colette.
I just wanted to ask.
WBAI.org. You can bring up all you want to list. Okay.
I just wanted to ask if we're thinking at all about coming out into the outside world again at all in terms of tabling, or are we feeling any more you're secure about that now that a lot of us are vaccinated? I mean, I would feel fine about being on the street and doing something, or so. I just wondered if there was any thoughts about that.
That's an excellent question. I mean, the approach that we're taking is that whoever feels safe doing it in a safe way can do it. But we're not specifically asking people to do it because it's very much an individual decision based on your own kind of risk analysis. Ting?
I just want to say I was back in Albany for the first time in a year, a couple of weeks ago, with a few thousand other people to lobby for the Invest in Our New York. And it seemed like, it was great. It was a really good thing to do, and I had no problem with it. And I plan to be in the street for a bunch of things in the coming months.
Okay.
So maybe you can collaborate, anybody who wants to do that and feels comfortable doing that.
Yeah, we can send to our email list if things like when Jennifer has her thing ready to go, we can talk about getting that out and so forth.
Yeah, that absolutely. And that, I think on a state level, we should be talking about that. I think we should let Ursula know about that and have people from all over the state be part of it.
I can't promise, but I'm pretty sure that NIPAN would be happy to throw its weight behind promoting it statewide as well. If you have some kind of regular streaming thing that you get going.
That sounds really great. Thank you for that. Anything else? Anyone else? Otherwise, we have just a couple of announcements. Well, one Ting you made about the week of action already, but I don't have. There was a toolkit for tomorrow being a call-in day, but I haven't seen anything about that since the original announcement. So I'm not absolutely
link in the chat for tomorrow, for Thursday.
There was something, the 7th was supposed to be a call-in day, but then I stopped hearing about it. So I'm not sure if it was changed. Because tomorrow is World Health Day. And so there were going to be some actions around that, but I can't really announce that because I don't know if it's actually happening or not. And there's a PNHP forum about the hospitals, which is, I have the flyer sitting here now. I'm not seeing it, but I want to be able to give you the exact information. It's it is on Tuesday, April 20th, and it's why hospitals and the people they serve should support single payer and the New York Health Act. So that one is a good one to spread around to everybody who is at all connected with the healthcare worker world and everybody else. I mean, of course, all of us who are passionate single payer supporters. Also, just as a local, not specifically New York Health Act, because it's the city, but UPA is having a candidate forum for our district for the city council candidates a week from tonight, right? That's it. Yeah.
Yep.
Okay.
Same
Great.
Zoom, by the way.
Yeah, this NIPAN Zoom is our Zoom for everything UPA, which is very much appreciated.
And that'll be at 7:30.
All right. I'm sorry. Oh, it's at 7:30 a week from tonight. The forum. Okay, so any other announcements before we say goodnight and set the date of our next meeting? Okay, thank you, everybody. It's been a pleasure. And our next meeting, we're back on our regular old schedule. Tim, you had something? Did you? Oh, you're waving goodbye. Okay, so it's the first Tuesday in May, which I believe is the 4th. I feel somehow a loss of not having my calendar in front of me, but does that sound right? The 4th
Yes,
is the Tuesday?
Yes.
Okay, so same Zoom, same time,
We'll
first
send it out.
Tuesday. Yeah, we will. Okay, well, wonderful to see everybody. It's almost like our in-person meetings pre-COVID, minus the snacks. And once again, huge congrats to Rachel. It's just really great to have you here. This is, I guess, your last meeting with us, and we're delighted to, in any way, have been a part of your single payer world. You've done a tremendous, tremendous service to.
I believe that's Dr. Rachel, right?
Thank you very much. And I will definitely be back when the New York Health Act passes. So I will visit you all then.
Thank you. Good night, everybody. It's great to see you and to see all the
Bye.
inspiring information coming back and
Safe.
forth.
Yep.
Good night.
Good night.
Night, Janet.
Good night.